just like all viruses, it needs to reach a target, which is your lung. And it has to get there with your help. It has no feet and no wings. So therefore, it needs us to move it there. So that's why we keep saying, don't hang around sneezy people because you're going to breathe it in. And don't touch your face because that's how the virus is going to get in. The masks are helpful, but they're not necessary because they're leaky. The ones that you and I buy basically have pockets here, so therefore the virus can get in. What the masks really do is they stop us from touching our face. If you're sick, we tend to mask you, so therefore you're not spewing out the viruses to other people sitting around you. The true people that have the real masks are the N95. Those are sealed. These are for the doctors that may be caring for the patients. So in the beginning, the coronavirus will cause kind of like flu-like symptoms or a cold. So people just get the stuffy nose, that kind of thing. But you'll understand that as soon as that virus starts manufacturing in your lung cells, they're producing all these copies of the virus, all of a sudden now you kill the lung cells. So now you can't exchange oxygen. And that's why one of the early symptoms is people get very short of breath and they tend to have a difficult time breathing. And that's why they end up in hospital. So currently, unfortunately, we don't have a direct treatment for the coronavirus. So we don't have a medication that can kill it off. And so it's really supportive. So in other words, the patient can't breathe. We give them oxygen, help them to breathe. They can't drink, so therefore we give them fluids to support them. Their kidneys begin to shut down. We help them with all those things. So it's a very supportive process. This is a new virus that we've never seen before. So our immune system, our army, are having a hard time figuring out what to do. So usually what we have to do is we make something called antibodies. So these are things that can grab onto the spikes that we see on the virus and it'll get rid of the virus for you. And that will actually bring you back to good health. So therefore the elderly may have a worse outcome. And of course the young children, so the babies, their immune system is not so good either. So they may not make those antibodies as well.
在密切接触的家庭成员里传播冠状病毒并不难。首先是喷嚏，你会喷出10000个以上的飞沫，最远传到8米以外。然后是咳嗽，1000到2000粒飞沫，最远6米。最后，即使是平静的说话，每分钟也会产生大概500粒飞沫。这是你打出喷嚏后0.34秒的样子。绿色的是那些100微米以上大飞沫的运动轨迹，因为足够重，它们会在10秒内落在地上。而红色的则是小飞沫形成的雾云。它们会在空气中迅速蒸发变小，成为干燥的飞沫核。上皮细胞蛋白质会包裹着冠状病毒，在空气中飘荡，接触其他人的黏膜。看起来戴口罩当然是个好办法。口罩的多层结构可以有效阻隔大颗粒，而那些纳米级的微粒又会因为静电效应被吸附在内部纤维上。N95 的过滤效果当然最好，但即便是效果最烂的纱布口罩，对于10微米以上，也就是我们头发直径1/10左右的颗粒，也能做到接近80%的防护率。那飞沫核的尺寸到底有多大呢？根据这份07年的论文，咳嗽产生的飞沫核尺寸82%都集中在0.74至2.12微米。这么看，绝大多数飞沫核用普通的医用口罩就已经够了。而在美国2800多名流感医护人员参与的一项随机试验中，佩戴 N95 口罩和医用口罩的流感感染率甚至没有明显差别。所以也别在意那些复杂的口罩类型、品牌和各国标准了。相比是不是戴着 N95， 更重要的是，你洗手了吗？洗手是因为你的手上很可能有活着的冠状病毒。以 SARS 病毒为例，在这份军事医学科学院的研究中，他们在玻璃、塑料、金属上都可以存活至少2天。它们会随着飞沫留在各种地方，而你的手很可能就会摸到。然后你揉眼睛、抠鼻屎的时候，病毒就会接触到黏膜细胞，完成感染。所以洗手，洗久一点。